Good afternoon, Minnesota. Thanks for taking a little time out of your day on this beautiful sunny day to get an update on where we stand on this. We described as a long, dark winter 15 months ago. I'm joined today by very familiar faces. Commissioner of Minnesota Department of Health, Jen Malcolm, will be with you after I brief a little bit, and the Commissioner of the Department of Employment and Economic Development, Steve Grove, will be with you. I would note that there is a whole team of folks over these last 15 months as we've stood in front of you and tried to make sure that we got you as much information possible to keep you, your families, and our state safe. There's been a lot of these briefings that have been painful. They have included a lot of tough decisions and a lot of very challenging impacts on your families, both health-wise, emotionally, and certainly economically, too. The teams across state government, our private sector partners, and I especially want to say a thank you to those frontline health workers who have been there, child care providers, folks who processed our food or served worked at the grocery stores, so many, and then to you, Minnesotans. It's been a long journey, but we did the things that needed to be done, and today we want to talk about where we're at. And as all Minnesotans know, the job's not done till it's done, but the plan to finish it is on us now. We've got the opportunity, and we want to just take a few minutes to walk through that. First of all, our goal when we first started talking back in March was to balance safety, our well-being, and our livelihoods. That meant making those hard decisions, but understanding that public health is dependent on each and every one of us making good decisions that impact our neighbors in a positive way also. It also meant understanding that there was going to be economic hits to certain industries, making sure that we were providing the support for them, making sure that there was economic incentives there, and that we were trying to make sure we brought everyone through this. We, at the beginning of this pandemic, knew very little about this new respiratory disease. The modeling was a little bit wide because we hadn't seen a lot of things that were out there. But we knew early on, like every respiratory disease, if you could stop that interactions with folks, if you could do things like masking and social distancing, and if you could limit unpredictable gatherings of people outside their immediate family, you had an opportunity to slow it. But we knew all along. Back in March and April of last year, I used a statement where I said our only vaccine is our ability to social distance and mitigate. That is no longer true. And because of what you've done, you put us in a better spot than a lot of other folks. We rank near the top as far as testing, as far as cases that we have in the lowest, and the one that matters the most is the fewest deaths amongst all of the states and states of any size. Minnesota does incredibly well on that. That's because of all of that hard work of all of those groups involved. We also made it a commitment during this time that we'd take care of our own. This is a state that takes care of their own. Recently, with data from the Census Bureau around a whole spectrum of things, Minnesota kids fared better than in any other state. Minnesota's first in the nation in COVID vaccination and distribution of this. That was incredible hard work among state employees, private sector, nonprofits, faith-based groups, getting into every corner of the state. I want to be very clear about this. That work continues, and that work is now even harder. We're moving from large community vaccination sites to literally door to door. So now is the time for us to get there. And when it came time to trying to figure out who had COVID and what we needed to do, we've led the nation since the beginning in COVID testing. And here's the one that I'm most proud of. Some of you have seen this map. When they go out and ask folks, are you likely to get the vaccine? The purple color means the highest amount, ranging above 90%. Minnesota has the highest uptake, and we have the highest desire to get this. We can continue to get this vaccine, and every one of those doses protects not only you or the person getting the shot, it protects the neighbor, the community, and returns us to normal. So Minnesotans, you're going to hear us continue to say this. We've got a little ways to go, and the path out of this is getting to every one of those communities. So as you're thinking about this, think about the pitch you're going to make to your uncle who says he doesn't need to get the vaccine. Those of you who are out there who are concerned for health reasons, talk to your doctor. And like me, what I'm doing right now with one of those young folks that fall between 12 and 15, talking to our pediatrician and making arrangements when we have the capacity and we get the authorization to give the doses to our children. Let's get them done and protect them. It's critically important. And we can do that all right now. The state of Minnesota has the capacity. The state of Minnesota is delivering them faster than anybody. And this week, the federal government has given flexibility for states that are doing a really good job to request more doses if they can figure out how to get it out. And I'd like to note amongst this vaccination piece, and we'll talk a little bit, here's what it did. You've seen this chart a lot going clear back to last April as the first COVID cases started to show up. And like many respiratory diseases, they spike in the winter months. Well, we were making mitigation efforts. We put things in place. But even though we did those things in October and had to maybe slow things down, we still saw a massive spike. And that massive spike of cases is followed by deaths. Deaths that we can prevent if we do things right. Minnesotans did that. We dropped off dramatically. We saw that little bump you see right at the bottom there was right after Christmas. We put in mitigation efforts, and we didn't need to change them. And as you started to see in March, where the new variant, the B117 variant from the UK, started to rise again, lots of concerns across the country, lots of concerns around the world. We kept course, stayed on, asked Minnesotans to social distance, wear their mask, and to get vaccinated. And because of that, we put a cap on how far it would go. A lot of the health experts would tell us that the transmissibility of that variant and how much it was in our community would have spiked probably beyond what we saw in November and December and equated into a massive run on our hospitals that could potentially have overrun it. You're seeing that play itself out in places like India today at 2% vaccination rates. That's what happens. We didn't do that. The rate is coming down, but I want to note, and I'm sure Commissioner Malcolm will note, that is still too high of where it stands. We need to continue to depress that number. It will continue to naturally start to fall off now because the surge has gone over. But what we don't want to do is what we saw through the months of June, July, and August last year. It plateaued and didn't go any lower. We need to drive it down to nothing. Over 2.5 million Minnesotans have had the vaccine. Over 2 million of you are fully vaccinated. And these vaccines, I would just remind everyone, hundreds of millions of doses have been given. They've been given over now roughly almost a 7-month period, and they are incredibly safe and almost unimaginably effective. At this point in time, if you get this vaccine, you are not going to die from it, and the chance of even being hospitalized is incredibly small. We've come too far, Minnesota. Those of you who are out there, and there's a lot of you out there, especially younger people, who said, you know what? Let's let the vulnerable get theirs first. I don't need to be in line in front of them. Let my grandparents get it first. Get those who have underlying health conditions. Let's wait until it's our turn. It's your turn. If you're out there right now and you're 16 and above, get your vaccine. You can walk in. This is a process that you can go in. The whole process will take you 5 minutes. They'll monitor you for 15 minutes, and you'll be back doing whatever you need to do. You need to help Minnesota now. I'm asking you, give us a hand to get this last little bit. So they're available everywhere. And go on that site at the bottom, Vaccine Connector. Here's what happened on stopping the third wave of what you're seeing on this. It was a combination of things. The distancing, the masking, and the vaccinations help. What we're seeing now is case counts and hospitalizations are going down. They're still too high. We are still losing Minnesotans today, and we can save those lives if we get folks vaccinated and we continue a little while longer on the things that need to be done. And we stopped that overwhelming surge that was coming because we were far enough along when it came because of the sense of urgency so many of you showed. So thank you for that. And I don't know it's often when some of you went out, you went to the Mall of America, you went somewhere and you got a shot, you can say with certainty, and the science backs you up, those shots saved lives. You saved neighbors' lives, you made it better for folks, and it's starting to return us to where we want to be. And that's what you're probably here today. We've asked much of you. We followed the science. We tried to strike a proper balance. We have tried the best to get this right with the intention of saving lives, preserving hospital capacity, and striking the proper balance to understand how incredibly challenging this has been. So we've got a 3-step plan that's going to come. At the same time, we're going to ramp up, step up, and put our foot down on the gas on the vaccinations. End the statewide COVID-19 restrictions by May 28th, and we'll drop the state mask mandate by July 1st, or if we can hit 70% vaccinations, because that has an incredible impact on what happens. And then, of course, what we're all going to do, we're going to have a great summer. And this is right in front of us right now. So what we believe is cases are receding. We've protected our healthcare capacity. Our vaccine progress continues to be the best in the nation, and we're relentless around it. And I want to make note of this. The issue of equity in vaccines, whether it's geographic equity to greater Minnesota or to the Twin Cities, but especially amongst those community hardest hit and communities of color. Minnesota's got a plan on this. We are executing that plan. We are holding ourselves accountable and putting that data out there. And our plan was to make sure by the time we got to May 28th, if we execute to the best of our ability and folks help us and our community partners help us with this, that we will have equity. And it will not matter if you're Black, Indigenous, Latinx, or white, you will have the same vaccination rates across the state and across those ethnic and socioeconomic groups. That plan is in place. That's where this leads to. And they're readily available. And I want to, and Commissioner Malcolm will do a good job of this, caution those who are nervous, myself included, that this is a change back to that. We've got a little bit more work to do. We're sitting at about 60%. While that blunted a lot of it, we still saw some pretty high capacities. And as I said, we're still losing way too many Minnesotans, 13 today, that those can be for almost all of them preventable if we continue to do the things that we need to do that's necessary. So here's the way the steps will work. Starting tomorrow at noon, we begin these steps, especially outdoors. And I want to be clear about this. The outdoor piece that we've learned over the last year, much safer activities outdoors, much less chance of transmission, much more ability to do what you want to do. That coincides perfectly with Minnesotans getting back outdoors. It's not a coincidence that many of these respiratory diseases follow that pattern of starting to ramp up in the fall, spiking in the winter, and coming back down as we get to spring, and almost non-existent during the summer. That's where we're at, so it makes perfect sense that we should do that. No capacity or distancing outside at outdoor events, no mask requirements for outdoor venues smaller than 500, meaning if you're at a large stadium like the Twins game or the Saints game or at a music festival, you'll still be wearing masks till we hit that 70% or till July 1st. Indoor events, we've increased the occupancy on some of our larger events and then increased group sizes. Also on social gatherings, no limit outside. Indoors, we've increased that to 50. And again, this is following the science, following the transmission, but I want to be clear, and Commissioner Malcolm will say this, anytime you make a move, you increase the risk. The question that's always been around is, how do we mitigate the risk to the best of our ability, and what's an acceptable risk of people doing it? Minnesotans have done this as well as any state. You've taken it upon yourself to make sure you're not putting others at risk. Restaurants, there's no occupancy limits outside or distancing requirements. A good time of the year for that. You can get outside, you can set up. We have a lot of patios and opportunities that were built over the last year. Indoor table size will increase to 10, and the mandatory closing times will end tomorrow at noon, so you can stay open till state closing times. And step 2, this is the one we're going for, Minnesota. We got 3 weeks. We've got 22 days. We have a vaccination pace that must stay as high as it is. Our hope is that after many of you listening to this say, let's just go get it done and end this thing. That is what we're really asking you to do. At that point, all capacity limits and distancing requirements, indoors and outdoors, will end. The only requirements that will be in place at that time is the masking indoors, and for the largest outdoor events, once again, until we hit 70% vaccination rates or in July 1st. At the doses that we could get from the federal government, and at a pace that we were at about a month ago, obviously the universe of folks who aren't vaccinated is shrinking, so it becomes a little harder. But we have the doses that we can get this done just as quickly as possible if Minnesotans are willing to get out there and get it done. And businesses continue to have limited plans in place, and Commissioner Grove will talk about this. Please expect that a lot of businesses, whether it be on airlines or whether it be large department stores, grocery stores and things, none of what we're doing here prohibits them from putting things into place, or local entities. If a city or a county or a school district wants to do those things because of they know their situation well, they're allowed to do that. But the business limit plans, these plans have been in place since last June. There's no new added requirements to them, but key consumer protections are still will remain in place just till we get to the end of this. And then, of course, step 3, when we hit 70% of 16 plus, that's about 3.1 million. You see it up there, 3,087,404 Minnesotans. The statewide mask mandate will end. Many of you will choose to continue to wear them. Many have told me it's first year in a long time they never got a cold. There's just things that you can do, but that will be back then to make that decision for you or private businesses to make that decision. Just so you know, that's 473,000 doses. Do the math. We can do this. We've had days, and Commissioner Malcolm will tell you this, when we were at our peak, where we can vaccinate an awful lot of people, and we can do it awfully fast. I would like us, again, to maybe see the website get a little bit overwhelmed here, to see some of you who said, I kind of been waiting or whatever. Let's just hammer this thing out. It's 473, and then, just for the rest of you, this will be ongoing. I think it looks like now, and I can't speak with certainty on this, but it looks like there'll probably be booster shots into the future, but it won't be this. It'll be like how you get your flu shot, and those will be organized. You might do it on your yearly checkup with your doctor, or there may be flu clinics and COVID clinics set up where we can get folks vaccinated. And again, those local jurisdictions can still make their own decisions. And here we go. We've got, we're ready to go. You need to get your shot. Keeping in mind our little ones still aren't there yet, and we'll talk about this. Just because the school year coincides so closely with this, our safe learning plans that puts most of these decisions in the hand of local officials will continue on with them. Well over 90% of our students are back in in-person learning, but we'll continue this out. Most schools will end that first week of June, and then at that point in time, the safe learning plan will expire, and we'll talk about what we're doing with summer school and into the fall. That gives us an opportunity to get these little ones tested. Just as a side note, the 12 to 15 age group, that consists of about 284,000 young Minnesotans. 70% of that is about 200,000. We can have the doses to get them done. Again, I encourage parents to talk to their pediatricians. We anticipate maybe many of these shots will be given in doctor's offices or at clinics, wherever you feel most comfortable with your children, or we'll have the opportunity to make them available at state sites. We don't have that authorization yet. We anticipate maybe in the next week or two that may be coming, but we need to start planning about them. But just be smart and know that our little ones aren't there yet. We know we had a tragedy here a week ago where we lost a beautiful, sweet little first grader in this. While rare, it still happens, and no family should have to go through that. We have the capacity to really help them. And then get to the lake. This is where we're at. These things I hope some of you are noticing. May 28th puts it before Memorial Day weekend. That's going to be an important date for many of us. It's going to be a time to reflect on those we lost this year. It's going to be a time to reflect on those heroes who sacrificed, as we said in the beginning, whether they were public health officials that were out there, frontline healthcare workers, frontline food service workers. It's a pretty important time because we take that weekend to remember those who are willing to raise their hand and give their life in protection of democracy of this country. A lot of times this year, that's exactly what we were asking people to do in the line of a pandemic that we knew very little about and that was incredibly dangerous. So Memorial Day should be a special time here, a time of reflection, and a time, again, over these next 3 weeks, that we return to normalcy. So our path forward is pretty clear. Minnesota now, the next 3 weeks, really, it's on you to get the vaccines. It's on you to talk to your neighbors. It's on you to talk to your doctors. We have them available. They're out there. Every single one who gets that pushes us further. And I want to be clear on so many of these things. This is just the floor. I think the health officials would like to see us, as this continues on, to continue to push that number from 70, probably closer to 80 or 85. When it comes to things like measles, we have 92% of people on that, and we still see some outbreaks around that. So it's important for us to continue to just keep bumping up. But over the next 21 days, it's really our goal to move from 60 to 70% of vaccinations, which will have a dramatic impact, and the modeling shows this, dropping off on hospitalizations, dropping off on deaths, and dropping off on the community spread. So never been easier. I'm going to keep harping on this. I know you're sick of seeing me in particular on this. The way to not see me anymore is get a vaccine and end this thing. That's what we need to do. And those of you who have been hesitant on this and you're looking forward to it and you've been frustrated and you think I've gotten this wrong, get the vaccine to make sure you're around next November. Then you can cast that vote. This is your time. Don't blow this now. We've got the chance to get there. And every Minnesotan's going to get this done and get it together. So roll up your sleeves, Minnesota. This is a great day. There's been many of these days that have been very difficult, but you've listened. You've taken them in heart. You looked out for your neighbor. We took care of our own. And now we're on those final mile or so of this marathon. Let's win this thing. Let's end this strong. Let's recognize that there's still much more work to do. But I also think today, pause for a minute. We're here. We're here, we're here, we're here. We're going to have a summer where it's just the simple pleasures will be back again. And with that, to always keep me grounded, to keep me informed, and to make sure that Minnesotans have the very best health advice for them, Commissioner Malcolm.
Thank you, Governor Walz. Well, it is a good day to be here. You know, it was 14 months ago to the day that we gathered up at the Capitol in the press briefing room to announce Minnesota's first confirmed case of what we then called novel coronavirus. We had known for 6 weeks or so in advance of that it was going to happen, but it was March 6th that when we announced that first confirmed case. And we knew then that we were going to have some challenges and some hard days ahead, but we could not have predicted all of the twists and turns that would come. And as the governor has said, we have faced some truly historic challenges this last year, and it has strained us in so many ways. It's meant disruptions and loss for all of us. And for many, it's meant lost jobs and income. For so many, it meant disrupted school years and family plans. For way too many, it brought frightening new health problems, and for far too many, it meant the loss of beloved family members, friends, and coworkers. I think that's probably true of most people by this time, that you know somebody who's been deeply affected by COVID-19. We've had to learn to work differently and to consider in a new light things that we have taken for granted for so long. And this is a good day to share the positive news about the plans ahead and the path forward to increasing connectivity and normalcy. But as the governor has said, and I will say more in a minute, we do still have some work ahead to ensure that Minnesotans can make well-informed decisions and to make sure that we can get all Minnesotans protected. And it's a day to say thank you, as the governor has been doing. And I want to thank the governor as well for the very thoughtful approach he's taken, not just to today's announcement, but really throughout this pandemic. No governor's ever has an easy job, but to make these tough decisions and to try to get it right in the middle of an unprecedented pandemic is a pressure I can't imagine, even though I have observed it and shared some of it. But it's been apparent throughout this response that the governor takes very seriously that idea that he just described, the balance between health, economy, and societal well-being in that Venn diagram that you've seen many times over this last year. And striking that balance is incredibly difficult. It has made for many a long day and long meetings, looking at tons of data, hearing from people with legitimate but often competing perspectives on things. And to try to get the balance right has been quite an impressive thing to watch and participate in. And the governor's always been willing to listen and continues to do that with regard to the importance of staying vigilant on the remaining health risks that we have here. The governor has thanked Minnesotans, and I just want to echo that. We're here today because of you, because of all the things that Minnesotans have done right. We've done the health mitigations as well as any state, and we're proceeding well on getting vaccinated, which is the biggest thing we can do at this point. And as the governor showed you with the data, we know that those practices of adhering to social distancing, wearing masks, staying home when people are sick, and getting tested when they needed to, all of that has made a big difference, and it has saved lives, and especially the big vaccine progress we've made in the last several months has helped us to avert what would have been a truly terrible crisis. We have made great progress on vaccines. And there are still a lot of people who are unprotected and susceptible to COVID. And for those who are not yet vaccinated, I just want to say that many of the activities that are no longer going to be prohibited by government action are still risky for people who aren't vaccinated. So we will continue to urge that folks make well-informed decisions about the risk they are putting themselves and other people at if they remain unvaccinated. And we've worked hard and are working hard to make vaccines more convenient and equitable and accessible, and to give people the information they want and need to make the choice that is theirs as to whether to get vaccinated. And we need to do much more in each of these areas, and will in the weeks ahead. And my friend and colleague, Commissioner Grove, will talk about the critical importance of recovering and rebuilding and reconnecting our businesses, our communities, and so much more. And we need to keep doing that work of reconnecting while still keeping up our guard against COVID to protect the progress we've made. And frankly, to keep on doing some of those things that have turned out to be best practices about improved hygiene practices and so forth, and personal responsibility when we are sick. So long as this virus is circulating, as it still is here at the high case rates that the governor mentioned, and around the world, it remains a threat to all of us. Every person COVID-19 infects is a chance for others to become sick and for the virus to mutate into new forms that could test us again. And the truly tragic stories, unimaginable almost, coming out of India over these last weeks are a reminder that the progress we've made here in Minnesota, the security that we are beginning to feel in our capability to manage this virus going forward is not the experience that many people are having around the world. And if the pandemic has taught us anything, it's that a threat to the health of the public anywhere in the world is a threat to people's health everywhere. We truly are connected, and we need to work together to finish this job globally. The governor alluded to the importance of the variants, and I just will continue to say that is the very real threat and the very real wild card here. So far, thank heaven, the vaccines have been protective against the major strains that have been circulating. But the more this virus continues to exist and spread, the more chance it has to throw off new mutations on the virus that will just continue to pose a risk. So vaccination around the world remains a critical job. And in closing, I just want to thank also the doctors, the nurses, all the healthcare providers, and all of the public health workers around the state. You have done incredible work, and the state, frankly, can never thank you enough. We know the pandemic is not over yet. We know there's still hard work to do, but the path forward is very much in our hands. We have the information and the tools and the resources to continue this progress. And we must continue and will the vital work of prevention and precaution, even as we look forward to much brighter days ahead. And with that, I'm happy to introduce Commissioner Steve Grove.
Yeah. Well, thank you, Commissioner. Governor, you said it well. Today is a good day. Today is a very good day. It's good to be with you. And it has been over a year, as the Commissioner and Governor said, that we have been working with workers and businesses across Minnesota on navigating this pandemic. We have had hundreds of meetings with thousands of businesses and workers, and they have all made countless sacrifices to keep our state safe. Time and again, we've come back to these leaders and asked for help. We've asked for help in keeping workers safe. We've asked for help in keeping gatherings to a minimum to prevent the spread of COVID-19. We've asked for help in distributing over 4 million masks across Minnesota to keep people safe. And most importantly, we've asked for help in getting Minnesotans and Minnesota workers vaccinated, which is the most important thing moving forward as well to get this pandemic behind us. And every single time we have asked for help, the business community and workers have answered. We are incredibly fortunate in Minnesota to have such a strong civic community, the kind of community where government and business can actually work together to get things done. And we don't take that for granted. The work that our economy has done together with our health department, with our state government, has quite literally saved thousands of lives, and we will forever be thankful for that. This is a big culmination in the journey. It certainly isn't the end of the journey, but we have a clear path forward now towards fully reopening Minnesota and ending COVID-19 restrictions. As the governor said, May 28th is that big date when restrictions will be gone. The masking mandate will soon follow. We know in talking to lots of businesses that they're going to try different things in the coming months. Smart business owners know that some caution here is advisable and that staging things out might be useful for some businesses. That kind of consumer confidence that's so important to getting our economy moving again means that different businesses will try different things in the coming months rather than just snapping back to some kind of pre-COVID reality. But the difference is today we're announcing that due to the great progress we've made on vaccinations, the time for the state to play that role in making those decisions is starting to fade. And a new era of personal responsibility for businesses, workers, and customers is going to take center stage. And the most important personal responsibility is, of course, as we've said many times today, to get vaccinated. It remains the clear path forward for our public health, but also for our economy. The more Minnesotans who are vaccinated, the stronger our collective consumer confidence is, the more people that want to get out and take jobs where they're open, the more people that are going to want to fill restaurants and concert venues and sports venues, all the things we love. Vaccines are the pathway for us to get there. Quite simply, vaccines equal confidence, and confidence equals economic growth. So as we as an agency in government focus on bringing jobs back to the state and helping job seekers find many of the great opportunities that are out there today, we know the most important driver of all of that is going to be rising revenues. So we ask all Minnesotans to get out and shop, get out to your restaurants, get out to your concert venues and your sports games, spend money at those local businesses that you want to see continue into the future. It's critical for the future of our economy that we all begin to spend our money at the places we know and love here in Minnesota. And recognize that while today is a milestone, the journey isn't over. We have an economic recovery ahead of us, and we have got to make sure that economic recovery is inclusive, that it creates jobs for all Minnesotans, and that we reskill our economy for the jobs of the future. Our economy has changed a lot in the last year, and it's not just going to go back to the way that it was, and it can't. We've got to focus on the persistent inequalities that exist in Minnesota's economy, and we've got to make sure we're looking to the future for the kinds of jobs that have longer-term growth. We know lots of folks are hiring. We know that at our department we're focusing every day on connecting workers with those jobs. We think if we work together, as we have throughout this entire pandemic, we can have a great economic recovery ahead of us as one Minnesota. So thanks, everyone, and Governor, back to you.
Well, well said, Commissioner. And there's two here. There's countless others, and I just can't say it enough. We all did this together, Minnesota. I've been surrounded by incredible people, incredible talent of trying to weigh out the data that's out there, from health data to the well-being, as we said, to the economic data. Too many to name, but I am going to name one. Every week I look at all of the data that's coming in, all of the health data that's collated, all of these people, epidemiologists, economists putting things in, and then I look at what all the other states are doing. How are they managing this? What are they putting in? And there's somebody that has to collate all that and put it into a workable place so that I can look at that and try and digest it. So I'm going to give a personal thank you to Patrick Tanis, the incredible work that's done in our office as kind of being the center point across this. And here we go, Minnesotans. The bats are cracking, as we talked about, as we speak. I hope they are over at Target Field on the Twins side. The chance to a full stadium of Skoll are coming soon. Opportunities for our children to be in the backyard with their friends, and you to be sitting around with the in-laws and everyone else around that fire, thinking about what this last year meant and how we came together. We've got this thing, Minnesota. You've heard it so many times. Continue to do the right things. Get that vaccine. Let's push that number up, and then let's get to May 28th where we can all celebrate together. So thank you, Minnesota, and you'll hear more from us. You'll hear the updates. Go to our websites. Go to get the vaccine. Roll up that sleeve and get it done. And again, what I need you to do is talk to your neighbors, talk to your relatives, talk to those folks who maybe haven't got it done yet, and just say, let's just do it. Now's the time. We can get out. So thank you all.
And thank you for joining us here live on MPR News. I'm Stephen John. We just heard Governor Tim Walz outline the final turning of the dial on pandemic restrictions in Minnesota, with a three-step plan to end restrictions by May 28th, ahead of the Memorial Day weekend, and the statewide mask mandate lifted by July 1st or sooner if the state gets to the 70% threshold of those 16 and older vaccinated. The governor says Minnesota's vaccination effort has put the state in a strong position to safely transition back toward normal life, and he held up the joys of summer as a real incentive to get vaccinated and get back to normal. So far, 2.5 million Minnesotans, the governor says, have been vaccinated. We are live here, and we're going to go live again at 1 o'clock as the governor takes questions from reporters about this and the rest of the news of the day in Minnesota. In the meantime, we're going to sort of recap a little further what we just heard. Our political editor, Mike Mulcahy, has been listening in. And Mike, this has very much been a political story from the get-go, with the governor's emergency powers being pushed back at by Republicans. I got to believe there's some happy folks in Minnesota in general who have heard this today, and the Republicans. What do you think they're going to have to say about it?
Well, we know, Stephen, what they've already said, which is Paul Gazelka, the Republican leader of the state Senate, said it's too late and not enough. He wants the governor to move faster to end his emergency powers. We've heard from Republicans in the state house who also say about the same thing. It's not enough and it's too late, that it should have happened earlier and that the governor should have consulted more with legislators. That's the political end of it. There's still a lot of politics to go, of course, because the legislature is meeting. The deadline for them to finish their work is May 17th. But, there's going to be some pushback against these emergency powers. And the governor is not ending his emergency powers, even with this announcement today. He says he's going to continue the statewide eviction moratorium. He's going to continue a statewide ban on price gouging and continue eligibility exemptions for people who receive state services. So he's not giving up his emergency powers here. And that could definitely be a bargaining point as the session moves toward at least the deadline. Maybe not the end, but at least the deadline.
As folks are just tuning in, we should recap a little further about what is going to happen here now the next few days, because the lifting of these restrictions actually kicks in as of tomorrow, where the governor says that they're removing capacity limits for outdoor dining, other events, other get-togethers, with the exception of those with more than 500 people. Some indoor activities will also come with fewer restrictions. And what else did we hear today? Any other surprises that you caught, Mike Mulcahy?
Well, also removing the early closing time tomorrow. And that first step tomorrow happens at noon. And then the second step begins on May 28th. The governor says at that point, remaining capacity and distancing limits will come to an end, including for indoor events and gatherings. And so that means more than 500 people can gather indoors, but the governor says at least at that point on May 28th, you'll still have to wear a mask.
Right.
There will be no new safety requirements for businesses at that point, although businesses and local governments can make their own rules, but there will be no state rules. And then, as you mentioned, Stephen, the third step comes either July 1st or at the point where 70% of Minnesotans age 16 or older have at least one dose of the vaccine. And at that point, the mask requirement will be lifted and the state will basically be out of the COVID restriction business.
And as far as how close we are to that point, as of the latest report today, 59.3% of Minnesota's population 16 and older has received at least one dose of a COVID vaccine. Just over 46% have completed their series of shots. That 59.3% is just a tick higher than yesterday, and the vaccination rate, as we've been told and we've been hearing, has really slowed down. Do we really think that we can hit that 70%? I mean, does the governor think that we can hit that 70% threshold even before July 1st?
I think they probably do. Although, we'll hear more at 1 o'clock when the governor takes some questions. But clearly, the message of this initial announcement today was keep getting your vaccine. If you haven't been vaccinated yet, go get the vaccine. That's what the governor said. That's what Health Commissioner Jan Malcolm said. The governor also said that ideally that 70% would just be the floor. And if you get closer to 80 or 85%, that would be best. That's when you start to get that herd immunity and COVID really goes away. Jan Malcolm said COVID is not going away. She said it remains a threat, especially these variant strains, and that the fewer people who are vaccinated, the more chance it is that those strains will gain a foothold because people will still be getting sick, the virus will still be being transferred, and that's how the variants come up.
And we also heard from the Commissioner of Department of Employment and Economic Development, Steve Grove, and he kind of said too that we're not back to normal yet because this is not done until it's done, and who knows when that will be. But he was talking about we do need to try to get as close to normal as we can. But again, they're just kind of reminding people that the only way we can get any of this done is if we get more and more people vaccinated. People continue in the meantime to wear their masks and keep their distances and that kind of thing. But the goal today from the governor and the state officials was to encourage people to and incentivize people to get their shots, get vaccinated. We can get to that 70% threshold, make a lot of people happy, and they can finally ditch their masks.
And Steve Grove said vaccines equal confidence, and confidence equals economic growth. And then he urged people to go out and spend money at their favorite businesses to keep them healthy and keep them alive in this as we come out of this pandemic. It really is kind of amazing. Jan Malcolm noted that it was 14 months ago to the day that the first confirmed case was announced in Minnesota. And it has been a wild 14 months, hasn't it?
It has indeed. We've been listening to a live press conference, not necessarily a press conference. That's to come here in the next 19 minutes with Governor Walz going back to the podium again here. And we'll bring you that on NPR News about the final scaling back of restrictions here in Minnesota on what's turned out to be the first day of our spring member drive. Mike Mulcahy, I'm going to let you get back to work in just a moment here, but we should remind listeners that these live events that we've been bringing you about the pandemic for over a year now are only possible because this is public radio. We take the time out, we offer you the newsmakers live, and then we analyze and bring you details that maybe you missed. This is how public radio works, and we are asking you, if you're a listener, to become a member today, and it's really easy to do. You pick up the phone, you call 800-227-2811, or you can click and join at mprnews.org.
And Stephen, I've been thinking about how many of these live events we've broadcast over the past year, how many you've been involved in, which is just about every day. I've been involved in a bunch of them, and I'm not even a regular on-air guy. So it has been quite a year. NPR has been there for you. We've brought you the news. We've brought you what's important. We've told you what you need to know, and we've tried to keep you informed at every turn. That's why you listen. That's why you appreciate it. That's why you should become a member today during this drive. 1-800-227-2811, mprnews.org. You can click and join there. It really does make a difference to this public radio station, the station that you listen to.
It is mprnews.org or 800-227-2811. Jan Malcolm, we just heard from her a little bit ago. Chris Erzman, one of her colleagues at the health department. They've really become household names with these live events that they've brought to Minnesotans, that we've brought to Minnesotans via them and the health department people. And it's been an interesting year indeed here in the broadcasting industry. And again, reminder that this is how it works. We oftentimes have to give up our typical fundraising activities to go live for a stretch of time. You can think about the impeachment hearings and stuff like that. But in the meantime, listeners are still there. We're still employing people. We're still paying for the equipment and all the rest. And so give it some thought and then give us a contribution at mprnews.org. Mike Mulcahy, thank you very much. We'll probably hear from you again here in just a little bit as we bring you again the governor live at 1 with the questions from the press. The use of his emergency powers as we started out our conversation today is just one of several topics in the mix in the closing days of the legislative session. Lawmakers are also deciding if law enforcement officers must change how they do their jobs. Some people involved in similar debates over the years carry low expectations of major change on that front. Here's Brian Back's report on why the current debate has echoes from deliberations of the past.
20 years ago, Latesa Ward sat with her hands clasped at a Senate committee witness table. She brought prepared remarks, but seldom broke eye contact with lawmakers as she recounted 2 traumatic incidents that shook her trust in police.
The first time I ever looked down the barrel of a gun, it was held by a white male in a blue uniform. I was living in Mounds View. I had my 13-year-old son with me, and there were cops surrounded by my car with their guns drawn and trained.
Ward was recounting an incident in 1989. A police cruiser traveling in the opposite direction spun around on Highway 10, and officers stopped Ward's vehicle. They mistook Ward and her son for black robbery suspects and detained the pair until realizing their error. 5 years later, and by then a lawyer, Ward was leaving a holiday work party in downtown Minneapolis. She stopped to challenge how police were dealing with 2 black youth in the city center shopping area. She soon found herself in custody and was struck in the face.
I was handcuffed by the police officers when this occurred. I was thrown to the floor head first, and then that officer knelt on my head and continued to abuse me.
As Ward, now 64, reflected recently on what happened to her that day, she couldn't help but draw parallels to how George Floyd died last May under the knee of another Minneapolis police officer.
A guy had his knee grinded into my back and neck area and stuff like that. They were doing that back then. That happened in '94, and I literally told him I couldn't breathe. My God, it's just so amazing. That is the sensation you get when somebody's doing that. You're not getting air. You're not getting oxygen.
Both of Ward's encounters led to lawsuits. One went all the way to the state Supreme Court, which ruled it could go forward against the city, but held that the individual officers were immune from liability. Each case resulted in financial awards. Ward hoped that by sharing the startling details with Minnesota legislators in 2001, they would do something significant to tackle concerns about race and policing. Ward certainly had their attention, but in retrospect, the story she and others shared didn't make a lasting impact on policy.
You know, when people start complaining and raising hell, then all of a sudden everybody's interested. And when they're not raising hell, or when, time has passed after incident, then they just kind of go back to the way things were.
Minneapolis civil rights activist Ron Edwards, who died last year, also warned lawmakers back then to take concerns of mistreatment seriously. But he sounded resigned.
Probably nothing meaningful will happen until we have a Rodney King type of incident in the state of Minnesota.
So what did pass in 2001? After considerable back and forth, lawmakers authorized a study of racial profiling. The Senate sponsor was DFLer Jane Ranum of Minneapolis, who held it up as an initial step in building community trust.
Studies show that Minnesota ranks near the top in disparities between blacks and whites in arrest and incarceration rates. To me, this highlights the need for study and action, not just by the police and sheriffs, but by the entire criminal justice system.
Despite calls for mandatory compiling of race data on traffic stops, it was deemed voluntary. Data wouldn't be connected to specific officers, as some advocates pressed for. 65 jurisdictions participated. Gavin Carney was one of the researchers. He's now a civil rights lawyer based in Chicago. He says the findings were clear.
Compared to the driving age population of the jurisdiction, Black and Latinx drivers were stopped far more frequently than would have been expected compared to overall stop rates. And in particular, Blacks were stopped, I think, over 3 times the expected amount.
When he and colleagues presented their study to state agency officials and legislators, Carney remembers the response as underwhelming.
It was sort of a quick, okay, thanks for doing this, and then that was about it, that there didn't seem to be much interest in better understanding what our findings suggested and taking action on it.
The data collection stopped when the study was complete. The 2001 legislation also sought model policies and more training tied to racial bias. It required the creation of a hotline in the Attorney General's office where people could report complaints of racial profiling. Those complaints were to be turned over to the Peace Officer Standards and Training Board, which was supposed to make summary data public. Those requirements also soon lapsed, and a Post Board official told NPR News in April that it doesn't have any corresponding complaint information. Fast forward to now. The legislature is again discussing how to balance public safety and public trust in law enforcement. They're weighing changes to traffic stops, misconduct investigations, and other areas of police accountability. DFL Representative Carlos Mariani of St. Paul is a key player. He was 10 years into his legislative career in 2001 and sponsored anti-racial profiling bills then. He sees now as the time to act because he knows that momentum for change can be fleeting.
Given our history, it will fade. And then we'll have another tragedy and we'll, try to address it again. That's not a good way for us to advance our most core important principles and protect the lives of our citizens.
Across the bargaining table is Republican Senator Warren Limmer of Maple Grove, who was also involved in the discussions 2 decades ago. Limmer says there have been recent strides. That includes laws passed last summer after George Floyd's death to ban chokeholds, raise the bar for when deadly force can be employed, and rework officer training.
I don't think our work is ever done. We come back here every year, and there's something new, and there's some new threat, something that goes on in the neighborhood that we got to catch our eyes onto. And so we continue, and we keep moving.
Latesa Ward doesn't have high hopes of much passing this year, even after Derek Chauvin's murder conviction in Floyd's killing and criminal charges against another police officer in Daunte Wright's recent traffic stop death.
Do I think the legislators are going to do anything about it on any level, state or federal? No, I don't. I would like for them to prove me wrong.
The next few days will determine whether Ward is proved wrong, or whether there will be another wait for more action on changing the way police officers do their jobs. Brian Baxt, NPR News.
Support comes from the University of Wisconsin Stout, encouraging students to go back to school online. Classes are designed for working adults and are transfer-friendly with credit agreements throughout the Midwest. uwstout.edu/online.
Support comes from Missouri River Energy Services, a not-for-profit provider of clean, reliable, and affordable electric energy to 25 Minnesota municipal utilities, creating a cleaner energy future. Customer-owned, hometown power. More mrenergy.com.
Support comes from the 29th Annual St. Croix Valley Pottery Tour, a national destination for handmade pottery. The Potter's web shops go live at 10 a.m. this Friday for virtual shopping. Preview 65 Potters at minnesotapotters.com.
This is NPR News. I'm Stephen John. Good to have you along on a kind of a first day of the member drive special here. We heard Governor Tim Walz earlier and other state officials announcing the latest turning of the dial on pandemic restrictions. And coming up at the top of the hour, the governor will return to the podium for a live press conference to take questions from reporters. Earlier in the hour, we heard the governor encouraging people to go out and get vaccinated so we can hit his reopening goals. But in some places, that's going to require public health officials to adjust their strategies. The governor even mentioned going door to door. Well, that shift has been on display in Duluth this week, where nurses have spent the last 2 afternoons in the downtown bus depot answering questions about vaccines and giving out free shots, no appointment required. Dan Crocker has this report.
You do Johnson & Johnson. It's one, and then you're done.
One and done.
Yep.
On Tuesday afternoon, public health nurse Emily Leon sat down with Chelsea Albin at the Duluth Transportation Center, explaining the vaccine options.
So if I take the second one, where do I get it, the second shot at?
Albin was waiting to take a bus home after finishing work as a dishwasher at a nearby Perkins restaurant. She eventually decides on the Pfizer vaccine. She fills out her paperwork and then sees another nurse who gives her the shot.
Congratulations. Thank you. I do too.
Albin, who's 30, had always planned to get vaccinated. She just hadn't gotten around to it yet.
I feel like everybody should get vaccinated. You know, it's like my whole family should take it. You know, it's like if they don't take it, they don't take it. But you know what? I feel safe taking it anyway.
But it took a very convenient pop-up clinic right on her bus route home from work to turn Albin from someone who planned to get vaccinated to an actual shot in an arm. Amy Westbrook is public health director for St. Louis County.
I think there are still a lot of people who are willing to get the vaccine if it's easy, if it's accessible, and if it's something that they don't have to go out of their way to get. Those are the people that we really want to facilitate the process for.
Vaccine clinics like this one in Duluth are emblematic of a shift in the state's effort to get more eligible people vaccinated. When the vaccine was first made widely available, some people went to extraordinary lengths to get it, spending hours searching for an appointment online or driving halfway across the state for an available shot.
But now we really have entered into this next phase where we are having to get really creative about how we reach out to people.
Rebecca Paulson is a public health nurse who works on St. Louis County's mobile vaccinating team, which has put on more than 100 small pop-up clinics around the county.
You know, for lack of a better way to say it, we're really meeting people where they're at.
The trade-off is it takes a lot more effort to reach a lot fewer people than at the beginning of the vaccine rollout. In the first hour and a half of yesterday's event in Duluth, Paulson says they vaccinated about 15 people.
And right now that feels really good. Maybe thinking back, we were running vaccine clinics in the southern part of St. Louis County where we were getting 800 people through a day. And so when you compare 800 to 15, it may sound like little, but at this point, 15 is really significant.
State Infectious Disease Director Chris Ayersman says as Minnesota enters this next phase of vaccine distribution, success will have to be measured differently.
Anytime we now move up by a percentage point in terms of Minnesotans who are vaccinated, that's a big deal because the work to reach people is necessarily going to be a bit harder in this stage.
Still, St. Louis County nurse Emily Leon says she's encouraged by what she's seen at the Duluth Transportation Center.
I feel like we've had more takers than I thought we would. I think we kind of went into this thinking that we would be heavier on the education piece with a lot of people that were hesitant about it. And I've seen way more people just come up here and ask to just get the vaccine right away.
Leon says a lot of people assume that if you haven't gotten vaccinated yet, it means you're in denial about COVID or against vaccines. But a lot of people are simply dealing with logistical barriers. They couldn't get off work or they needed somewhere easier to get to. That was the case for Karen Moore, who relies on the bus to get around.
I've been waiting for an opportunity to get the vaccine, hoping it would be at a convenient location and hoping it would be the Johnson so I'd be one and done.
Moore even got a free bus ride home, a little extra incentive to encourage more people to get a COVID shot. Dan Crocker, NPR News, Duluth.
This is a first day of the Spring Member Drive special broadcast here on NPR News. I'm Stephen John. On the day, Governor Tim Walz outlined the final turning of the dial on pandemic restrictions in Minnesota. NPR political reporter Mike Mulcahy has been listening along with me today. And a quick recap, Mike, of what the governor is going to be taking questions about in just a few minutes from reporters.
Basically a three-stage plan to end the COVID-based restrictions. Starting tomorrow at noon, removes limits on outdoor events. Then on May 28th, removes more limits, and by July 1st or sooner, if 70% of the population is vaccinated, mask requirement goes away.
Big announcement today made live here on NPR News. And as I mentioned, we're going to return to the governor and some state officials in just a couple of minutes as they hold a live press conference. The live events, it's the news headlines, the weather, the analysis that you turn to here on NPR. And yes, during the Spring Member Drive, we are asking you to do what you can to help power this kind of radio. If you go to your phone, 1-800-227-2811, you'll talk to a live person on the other end, or you can do it more anonymously if you choose at nprnews.org. But Mike, the important thing, as we've been saying all along here, is that live radio doesn't come free. Listeners have to step up and help pay for it.
And the reason is because you listen. You listen, you rely on it, you depend on the accurate and fair news that you hear. It's important to you. So it has a value. Is that value $5 a month, $10 a month, $20 a month, $25, whatever you decide. We won't set the level, you do. But make that call, 1-800-227-2811, or click and join at nprnews.org, because your contribution really will make a difference.
And that is the key about public radio. You get to decide what it's worth to you. There's no subscription price put on it. It is your hard-earned dollars that you're going to contribute to something important. And if you feel that way, we ask you right now to give what you can to support it. nprnews.org. If you choose to join today, you're going to get that special first day bonus gift. It's a stainless steel reusable straw keychains. You won't have to throw away a plastic straw every time you want to do some sipping this summer. Check it out at nprnews.org.
Support comes from Hallen & Law, representing courageous whistleblowers who call out corporate fraud. Hallen & Law helps whistleblowers speak up, stand strong, and fight for what's right. Results that make a difference. HALUNEN law.com.
This is NPR News 91.1 KNOW, Minneapolis, St. Paul, a live press conference with Governor Tim Walz coming up just a moment from now here on NPR. Listen to Mildred in Maplewood, who said, "I give because NPR is a reliable source for long-form journalism, and they have the humility to admit when there is more to be learned." That is a wonderful statement. Mildred, thank you. listeners say it best, why it's important to support public radio. Let us know why it's important to you and give what you can at mprnews.org. 58 degrees currently in the Twin Cities. A really nice early May day here. We're going to get up to about 62 or so, partly cloudy skies, rather breezy. And then tonight, a low in the upper 30s. It is 1 o'clock. I'm Stephen John. Good to have you along here on NPR News. We are live today. Governor Tim Walz, last hour, announcing the final turning of the dial on pandemic restrictions in Minnesota. And he's about to talk to reporters and take questions about the restrictions and how they'll be lifted and the timeline and the rest. And, of course, there will be other questions as well to the governor as we get into the final stages of the legislative session. Political editor, speaking of, Mike Mulcahy is along with me today. Hi, Mike.
Hi, Stephen. The governor really making a point that the key is that 70% of Minnesotans have at least that first shot of vaccination. And he says when that happens, 70% Minnesotans 16 and older get that vaccination, the mask requirement will go away and all the other requirements will too. He says either when we hit that benchmark or by July 1st. And it's interesting to note that he's really kind of extolling the virtues of summer here as an incentive to get vaccinated, as this weekend they're going to be lifting the capacity limits for outdoor dining and events and other get-togethers, with the exception of those with more than 500 people. Some indoor activities will also come with fewer restrictions. And then he's setting that May 28th date, the start of the Memorial Day weekend, for further restrictions, and then before the 4th of July, the 1st of July as the date that they're going to be lifting the mask mandate, or as you say, Mike, sooner if we can get to that 70% threshold of 16 and older vaccinated with one shot, that is, so not even fully vaccinated as far as that goes. So far, we're at 59.3% of the Minnesota population 16 and above that has received at least one dose of a vaccine, and just over 46% have completed their series of shots. We're standing by. The governor is going to be, as I mentioned, addressing reporters here, and on NPR News, it's live, and we see the governor coming into the room and approaching the podium here, and let's see what he has to say.
Good afternoon, everyone. Thank you for your patience and taking some time. I won't go through the whole presentation that we just did. You're well versed in this, and this room of reporters has deep knowledge over the last 14 to 15 months as the COVID pandemic has run forward. I'm joined again with Commissioner Malcolm, Commissioner Grove, but we also have Commissioner Mueller here because there's that little bit of piece in there where the Safe Learning Plan runs out the rest of this year, and then what we're looking at for summer. But glad to take any questions from folks. Yes, Esme.
Governor, you've gotten your fair share of criticism over the past year in your handling of this. As a former teacher, what grade would you give yourself when it comes to the handling of this pandemic, and what grade would you give your overall team?
Yeah, well, we're not done yet, so I'm a little cautious on that. I think it'll be, once we start to assess the data. I started to show it today, and as now there's a broader subset of data that we can start to look at. And again, measuring against deaths, measuring against hospitalizations, measuring against those goals that we talked about of not overwhelming the healthcare system, and then keeping resiliency and confidence in the economic sector. I think compared to the rest of the states, and when it came down to vaccines, Minnesota's near that top. I think as far as giving the grade on this, I think Minnesotans will assess that. They will put it out. The one thing is that you just wished you knew back then what you know now, but that's not the way the world works. This was a brand new, respiratory illness that no one had ever seen. But I think overall, I'm grateful for the team. I've watched them build capacity both inside government and outside government. I just got to be. One thing I worry about now that keeps me up is that I hope I didn't break this team of asking folks, because literally I don't know if Minnesotans see this. It's our job, and I don't ever believe you should get patted on the back for what you're supposed to do. But I asked a lot of these teams and folks that are working this to do 12, 14, 16-hour days, 7 days a week until the day we're at. But I think overall, what Minnesotans can know is that our death rate's as low as any place in the country. Our infection rate's is about as low. Our vaccination rates is the highest. Our economic resiliency seems strong and ready to rebound. And Minnesotans, again, take a big part in that. That map I keep showing, they took this social compact seriously. So I think overall, we'll wait till we get totally done with this thing. But we've responded, I think, the way the data, the ethics, the creativity, and the ability to be resilient when things did not work or could go a different direction. So Dave?
Yeah, I have a question for Commissioner Malcolm. Commissioner, just because you can do something doesn't mean you should do something. And we've seen time and time again across the country with this pandemic that there is a correlation by when you allow things to happen, people do it. These vaccines are not 100% effective. I'm wondering what sort of personal advice you'd be giving to people who are wondering, should I go to the Twins game with my kid who's unvaccinated or whatever?
It is a great question. And I think, as we said during the earlier section, just because government is no longer making the decisions or saying certain things are out of bounds doesn't mean that we don't all have to keep making well-informed decisions and think about our own individual risk, but also the risk of people around us. So I do think, that folks who are not yet vaccinated really need to think hard about what additional risks they're putting themselves and others at by doing some of the things I know they're eager to do. So I really hope that we can get that message across, and I thank you guys for helping with that the pandemic isn't gone, and this is now, as Commissioner Grove said earlier, the decision-making burden, if you will, or privilege shifts to us as individuals and businesses, and that's, we think, the natural evolution of things.
Governor Walz, I'm still confused about or uncertain about where the emergency powers stand. I know you're eliminating a lot of these emergency orders, but will you ask next week for an extension of the emergency powers? And should businesses be concerned if there's some new double secret variant that pops up, that a lot of these things could be put back in place?
They shouldn't be worried. They should know with confidence that we will continue to monitor this. We will do the things to keep Minnesotans safe. The authorities given under Chapter 12 that have been upheld in court after court allowed us to be able to do some flexibility. And people said this, well, the governor's using emergency powers. Yeah, to allow bars to pull tables out into the streets and use the right-of-way when we had to get outside more. So there are going to be a lot of the things that we put in place that are going to start to drop off. A lot of them are around licensing, being able to bring in outside nurses and doctors to be able to work here. The statement, as it became politicalized on emergency powers, is the governor wasn't working with the legislature. The system is set up at times where we need to move. Now, I would remind folks, in January, I gave a list of things that could be codified into law and taken off. Those are still being debated. And that's just kind of the nature of the legislature. So what I would tell you is, by the time we move through these things on the 28th of May and the 1st of July, later this afternoon, we'll be doing a new executive order that will basically put into place the rescission of, I believe, 26 of the 34 remaining emergency orders. And what will be left is my ability to use the National Guard, the eviction moratorium until the legislature can work that one out, and then some of the things that have to be in place so the federal government reimburses us.
So, but will you request an extension, a 30-day extension next week?
Yeah, yes, because those things need to stay in place for be able to get that. I would assume that the legislature would unanimously support that, because what they see now is, I think they conflated mitigations that they didn't like, regardless of where the pandemic was. Keep in mind, that was the same. The pandemic was roaring out of control and we didn't have vaccines. Take off all mitigations. The pandemic is done. It should have taken off earlier. So I think they'll probably understand that. It seems to me we're at a new point here, because the end sight, if you will, of state mitigation efforts is done.
And as a quick follow-up on some of the specific impacts of this, What about professional sports? The Minnesota Wild have playoff games coming up. The Twins season is going on. The Timberwolves, there's big events like Grandma's Marathon in June. Are those events all, they're going to be able to start having build toward full capacity?
Yep, that's the way it's set up. There's no restrictions after the 28th. Outdoor activities, they can go now. They need to remain masked. If you're at Target Field, you can do that. But all these other events are good to go. The last things after the 28th of May, there's some of the business mitigations that are put in place. Nothing new. Those are already there. And then the mask requirement. And I'm asking Minnesotans, if you want to end the mask requirement, the simplest way to do that is let's close out this last 10%. You saw the number, about 474,000. We have the capacity to give 50, 60,000 a day if people choose to show up. And so those events will happen. Those are all on now. And in fact, is the outdoor events are no limit tomorrow at noon. So we had one, Peter, sorry.
I hate to be crass and talk about politics, but I will. How do you think this plays for the rest of this session, given that issues surrounding emergency powers and emergency orders have created tensions? Do you think this helps close out the session? The reaction today from the Republicans was not maybe what you might have thought you would get.
No, I can't really, because I don't know how the response will be. I had to respond through this through the lens of public health. And as I said, I recognize many of these decisions are very unpopular, but I think in the end, when people look back and start to see some of those numbers, they were successful. So I think today I'm gonna let Minnesotans enjoy what we did. I think there's some folks over there that it may impact how they see things differently. I mean, this is the right time to do this. We proved that we could do this. I would remind it, and Commissioner Malcolm's right, we're still above 1,000 cases a day. We have over 46%, I believe, community spread. We're still at 29 cases per 100,000. All of those are still very, very high, and we had 13 deaths. So I want to just be clear, it's the trajectory of this, it's the glide path. If all the modeling, especially the Mayo model that has become very accurate in a short window, if Minnesotans continue to do what we're asking, and if they step up a little bit here on vaccinations, the next 2 weeks should see a 25% or bigger drop. If you know, I don't know, I can't speak for them. I'm ready to get a budget done that brings Minnesota's economy back, that takes care of those who are most impacted. And we're still monitoring and doing our job around COVID, but obviously the state's role in that is now on vaccinations and testing, some of those things. So it's much less than it was. We have got another one back here.
Yeah, Governor, I'm curious about lifting the mask mandate before all age groups are eligible for the vaccine. Does that put 12 and under kids at more risk?
Jan, I might have you ask this. This is always a challenging one. Again, I'm trying to strike that Venn diagram, well-being. I think I feel more confident about it with school being out and it being summer, what we're seeing. And I think, again, the under 12, it probably is not going to be fall. Jan could speak to that. We're looking at what we're hearing from CDC is maybe fall for those 2 and above. But it sounds like over the next couple weeks, we should get authorization to do 12 through 15. But I think, you know, our thinking around this is, I'll let Jan clarify, that is, they're still at risk there. Again, anything we do still has that risk, but the risk is significantly mitigated of moving into summer and the general population's vaccination numbers continuing to increase. So Jan.
Yeah, I think the governor got the key points there. And just to be specific, we're anticipating that the Pfizer vaccine the emergency use authorization will be amended to allow Pfizer for 12 and up. We know that both Moderna and Johnson & Johnson are also doing clinical trials of their vaccines for younger populations, and we expect that those two will be coming online probably in a matter of months. So our hope is that we'll have a good vaccine supply and a robust vaccination effort before school starts again. And as the governor said, the outdoor environments and kids especially very good at maximizing that. That we feel like this is a time when relaxing the mandate is as a rule, makes some sense. But again, we will continue to give guidance that in certain settings for certain people, they really should continue to mask if they're not vaccinated. In terms of the really young kids, we've been told it might be into 2022 before we see vaccination down to the very young ages. But school-age kids, we expect to see pretty good progress here.
Yes.
So you've been hesitant before to stick any incentives onto vaccination, like a vaccine passport. You said, just go get the shot, I believe you said at one point. Now you're kind of making vaccine an incentive, and a couple people already emailed me saying they feel like it's almost vaccine blackmail. But what do you say to that? You didn't want to use it as an incentive before, and now why are you doing that?
You mean around masks?
Yes, I mean, you're sticking out the end of the mask mandate on getting vaccinated. So.
Yeah, we're taking all these things off before we hit that number, because I think the science is pretty good that there's, the difference between 68 and 70. We obviously want it to get continuously higher. I just want to note on this, the politicization around masks, I think history is going to write as one of the worst things that's happened to this country. I think it costs lives. I think it's stupid. It's the least intrusive thing we can do, and it contained to get in that. I'm just asking people to put that, as it's been in many cases, back in their hands to try and do that. I'm actually a fan around incentivizing vaccines for some folks. I don't assume all these folks are anti-vaxxers. I continue to say that. I think there's a whole lot of folks who wanted others to get in line first, but I would just say, I'm just putting it in their hands. If you don't like the mask, then let's get vaccinated. But I also said I put a date on it. We may not be to 70%. I hope I'm wrong. I think we will be. But let's just say we're not. We're still removing that mandate because the number will be relatively close to that threshold. And I think what Commissioner Malcolm would say is that let's just say from the 1st of July then on into the fall, we need to keep driving that number higher and higher. I mentioned again that measles vaccination rates are 92%. And that proved in that case of that disease, we still had outbreaks around it. So we're going to have these hot spots. We're going to have these outbreaks, but at that point in time, our epidemiologists and our contact tracing teams will actually have work, because our community spread will not be at 40%. It'll be dropped way back down, and we can tell where people are getting it.
How much thought did you put into the 70% number is going to be reached based on the strength of people in these counties that are already at 70% or close to it and will continue to go higher, while in some counties in central Minnesota especially, the vaccine rate is stuck in the 30s, and they're less inclined to wear a mask. Some people there are less inclined to wear a mask anyway. How much thought did you put into that county by county issue?
Yeah, Jan, we may talk, this has been up since the beginning of this, of trying to do county by county, thinking about it. I certainly, there were suggestions out there, for example, that why don't you open up, take the masks off, let all the bars open once they reached a vaccine rate, and those counties that weren't there then, they wouldn't be able to do that. At this point in time, it's really more apparent than ever. I said this starting in the beginning, there's certain mandates I can put on, but there really is a social compact. You really need people to do this. It feels to me, and we'll see if I'm wrong or not, I think for those who didn't know where the finish line was, who were concerned that the governor will keep moving the goalposts, he'll keep doing this, and then it became so political. Now none of that's there. This is just straight up. This stuff's ending. Got the opportunity to go, and you really need to help Minnesota by getting this. Like I said, if there's a group of folks and they're saying, wow, we can go to a packed Twin Stadium, somebody in that group needs to tell Larry that he needs to go in and get his vaccine, that day is over. Just go get it, dude. You can get in, you can walk in, you're out in 20 minutes, and let's move on. You don't even have to tell anybody you did it. Just go do it. So I don't want to get us into this. We show that county data, and I think it's important. We talked about disaggregating, but I also think it adds a little bit to this, that there's a huge difference amongst the state. I need those folks to be vaccinated. I don't want to single it out. There's a lot of growth there. I see that. There's a lot of opportunity in those counties, and maybe now is the time, because for many of them now, the things that maybe bothered them the most, they know is date certain going away. And I told the legislature this, if you're worried about this, codify it and I'll sign it. Say all this stuff ends on the 28th, just as the governor said, put it into law and send it over to my desk then. Then there's law behind it. You don't have to worry about it. And give your constituents confidence that this is there. And again, I would say for people, we have hundreds of millions of doses out. 7 months of data in the real world, if you are a little bit worried about the safety of these vaccines, that has shown itself to be pretty good. Peter, as I thought a little more about you, you mentioned the political question. I'm kind of savoring a day for Minnesotans to be happy about this. I will go out of my way to make the difference. Now, I feel very comfortable. Now is maybe the time. Those folks who aren't so certain, I'm going to invite them to my house for a barbecue so we can get the legislators back in. We'll get together. We'll sit in the backyard and we'll figure it out. We can get back to normal. So my pledge to them is to figure this out now. Some of that angst should be gone away. I'm confident that that many of them want to get this budget done too. More?
Can I ask about the timing of this? Why not just do all of this on May 14th? Why do something now and then on the 28th?
Yeah, Jan, you want to talk?
And also, is this time to Memorial Day and to 4th of July? It seems like they are.
Well, I will have Jan talk about this. This has to do with the lag period. We're still at a very high number. We're doing some of those things today because I think mitigating that risk. The big move that's coming on the 28th, we need this lag period to come back down. We've stalled just a little bit, but it will come. We think, and then Jan, you can tell us this, if Minnesotans do this, if that vaccination rate keeps going up, by the time we get to May 28th, we will not be at 1,600 cases or 5.9% positivity. We'll probably be closer to 600 cases at 3% positivity and the deaths going down. So the timing has to do with the lag of where we're going. And I will just be candid with you. I think what Minnesotans have gone through and what they've done, I was pretty adamant that it may have looked like we should have gone 4 weeks on this. The difference between 4 weeks and 3.5 meant that they could do Memorial Day. That did matter. And then, of course, the July 1st date. That makes good epidemiological sense where we're at, but it also ties into the president's goals that we have a federal policy on this, and we are doing what we can do. And so many of these things, people are asking, why don't you do this? Why don't you do that? It's because CDC guidance says this is where we should go, and we're still following that. So.
I really have very little to add to that, except to say that with the patterns that we've seen, every couple weeks really does matter. It increases, and we're hoping that the trends continue as they are, that the cases keep coming down and the vaccines keep going up, and hopefully with some of the new strategies that we're putting in place, the more community-based events, you'll see more of our public education media campaign, more from our outreach efforts into communities. We're hoping we can generate some more demand that's closer to the pace we were at a few weeks ago. So that might seem like a trivial difference, but I think those couple of weeks could make a big difference on both fronts.
Commissioner Grove, I have a question for you. If you could, it's actually kind of a two-part question. Some of the things we get emails about a lot at the station, weddings, many of them that were postponed from last summer to this summer, both the church services and the receptions. If they're having them after May 28th, it sounds like should be able to be pretty much back to normal without masks and different things. And then also the impact on fitness centers, short-term and long-term.
Yeah, so after May 28th, no restrictions at all on any of those events that you just mentioned. In the interim, gyms still remain at 50%. Religious services in the interim, starting tomorrow at noon, will only have the restriction that the groups who come to that religious service together need to be 10 or fewer, or a household size, and have 6 feet between them. So it's a social distancing restriction for religious services, but there's no caps on the numbers of people in the room or capacity percentage for religious services. And then, as you mentioned,
and in terms of, well, on the fitness centers, there's the requirement now that you got to wear a mask at all times, including in classes when you're on machines. Is that all staying in place, or is there an easing of that before the mask mandate goes away?
No, if you're an indoor fitness center, which most fitness centers are, the mask mandate will remain until we get to 70%. One other change for fitness centers, though, since you do mention it, is the class size is going up as of tomorrow to 50 people. It's currently at 25. So there is some loosening of restrictions in gyms, which is good. But again, as an indoor environment, the masking mandate remains there, congruent with other indoor settings.
Can you go over that church service thing again? I'm a little confused by that.
So as of tomorrow at noon, religious services will not have a capacity percentage or a capacity cap. However, social distancing will be required between groups who come to that service together, right? So if you're a group of 10 that came to that service together or fewer, you can congregate together, but then it'll be 6 feet between those groups. Between those groups in a religious service.
Well, so doesn't that in some ways put a cap if there's not enough space?
Certainly, yeah. Social distancing at 6 feet is in many ways the kind of last remaining component of any kind of a cap for any indoor venue right now, given the kind of math you have to do to figure out how many folks you can fit inside based on that requirement. But as of May 28th, that social distancing requirement of 6 feet between parties or between people will be gone.
Okay.
I just have a question about what it will look like.
We have lost our audio
Is it?
momentarily here
Yeah.
on NPR News. I guess they're working to get it back. And I don't think it's on our end. It appears to be happening at the press conference itself.
Yeah, and the governor may want to talk about this, or Jan. I'll just say, we are talking to the State Fair consistently. These restrictions being lifted at this pace clearly will allow the State Fair to take whatever appropriate measures they want to take to keep guests safe, but there'll be no state restrictions on the State Fair as it relates to either masking by the time that State Fair hits or overall capacity percentages. For outdoor events, as of tomorrow, really outdoor events are really pretty open. Parades, festivals, gatherings in parks, all these events that are so great about summer, as of tomorrow, will proceed as they might usually in any given summer. For venues in which there's sort of an enclosed venue and you have 500 or more people, the masking requirement will remain for outdoors, but even that, as of tomorrow, is gone for other sort of community events like this. So, we know business leaders, fair officials, others are going to navigate how to get this right for their venues. They want to make sure people feel safe coming to their events. So we expect to see some innovative and different solutions from those businesses. It's just that the time for the state to provide that guidance is fading here in the coming weeks.
But isn't there any concern, especially around children? Your numbers are still high in terms of cases. There's still a lot of people who aren't vaccinated. And I think people might wonder, well, is the summer camp or the summer rec leagues going to look the same? And people, I think, might be worried about that.
That's probably best answered by the governor. Yeah.
Yes, Esme. I want to acknowledge this uncertainty, this unease, and some anxiety. It's interesting to me now that, of course, that piece is what we've been worried about the whole time, because we've heard, again, since the beginning of this, why are you doing any of these mitigations? Why are you doing that? Because people are terrified and it put them at risk. So I want to be very clear. I don't downplay that. I think what you're seeing, Esme, and I would ask us to skate where the puck is going to be with this vaccine effort, where we think we're heading, with outdoor activities, with the risk mitigation that are already in place, we should see a significantly better place to do that. But I think you brought up a very good point. Commissioner keeps saying that. I think families need to make these decisions, and we're going to continue to put out recommendations. I would assume that the Minnesota Department of Health will have a recommendation for masking even when the mandate is gone, that we recommend that you do this. And there will be businesses that will clearly, when you fly on Delta or you go to Target, I would anticipate to go in there, you'll need to have a mask on. That may be how they will start to approach us with the best guidance. This is striking that balance between keeping folks safe, well-being, and economics. We think that by the 28th of May, that strikes well, especially with the outdoor events.
What will schools look like in the fall? What will
I think a couple of things. When we're first thinking about summer, we are going to be working with the Minnesota Department of Health to really look at what our strong recommendations are going to be. So we know that up until the end of the school year, until the very last teacher day, so for the 2021 school year, our safe learning plan will be in effect. They will be able to do some of the outdoor pieces if they are doing outdoor activities, but really for indoors, we are maintaining what that safe learning plan looks like. Then we move into what the guidance is, the simple guidance that's been identified really beginning on May 28th, and we're going to utilize that for our summer school programming. Given that, we will have strong recommendations, like the governor said, around things like masking, things around social distancing and physical distancing, and really being thoughtful on those pieces. And we know that based on local control, our school districts, our superintendents, our charter school leaders are really going to be able to come together and decide what they would like to identify as a policy and a practice based on the strong recommendations that we've identified. In addition, If a school district or charter school chooses not to move forward with masking and putting forward a policy, families can always make that decision as well. A student can go to school wearing a mask. It gives them the opportunity to do that. And then as we look forward to fall, I think we're not ready to make a full decision around what that's going to look like. We're going to continue to monitor where we're at. We're going to continue to say, like, we are very hopeful, but hope isn't a strategy. And so what we're going to say is we're going to have that hope, and we're going to continue to look forward to seeing that this is going to be able to be as normal as possible based on what our school districts are doing. But we're also going to be cognizant of the fact that there are a lot of things that can change in a very short amount of time, and I think we've learned that better than anything else. And so we are going to have pieces in place to be able to help to support our school districts and our charter schools across the state, as well as students and families, to make sure that they have what they need in order to make decisions about where they want to go moving into the fall.
Thank you. Commissioner Mueller brought up a great point. The other day we were out in Hopkins School District at Alice Smith Elementary, and the question you're bringing up is, what about if you have a student that's immunocompromised or a family that can't get that over? That's why we will offer and still be offering virtual learning for those students. That'll be a choice that parents can make. Those will still be in place because we got asked about a piece of legislation to ban all virtual learning. Well, we're not taking that away from parents to make that decision for their children. They need to be able to have that, and we need to be able to offer it. Is that correct, Commissioner? Yeah. This was really interesting because it was a family that asked about this very issue.
Right, and I think that I appreciate that, and one of the things that's important is we do have legislation that's in front of our team now, really looking at how it is we can move forward with distance learning. Once the executive orders are removed and are rescinded, that means that distance learning, as we know it today, does not exist. We would need to move forward with an online environment, and so we have asked the legislature to please move this legislation around distance learning for at least this next year to allow us to be able to do what we need to do and what we want families to have the options of being able to do. So that's a really important piece that we want to be able to communicate, that our legislature has this in front of them now, and we are asking that they move this forward.
Governor, did you ever consider having a different type of mandate for people who've been vaccinated? So many Minnesotans have been fully vaccinated. Did you ever give any thought to, if you're vaccinated and you got proof of it, you don't need to wear a mask?
Yeah, well, no, thank you, Tom. We think of everything. When we have these discussions, there's a course of actions that I ask our team to bring up all these different ideas, and they're getting those ideas from going out and listening to people. I think we talked about early, some businesses may choose to go down this route, and I know, again, one of those things that got deeply politicized, the idea of a vaccine mandate, if you will, on that. At this point, one of the things is that I think I'm hesitant about that because of how it's been politicized. The other thing is, I think that chart I keep showing and our numbers keep reflecting this, Minnesotans' willingness to get vaccinated outpaces the rest of the country, and I think it makes it less of a necessity. And I quite honestly don't want to see what we saw around masking in some parts of the country where people were literally having fistfights in the produce aisle because someone wasn't wearing a mask or was wearing a mask. But I think you'll see, and I mean, this will be whether flying on a plane or some of those things. I think businesses, as Commissioner Grove said, it's going to be about confidence. Just because you take off the mandates, and we saw this early in this, reservations at restaurants don't spike out the roof because people are still like, I don't know if I'm comfortable to go back into a totally packed bar that's open until 2 a.m. with no capacity limit other than the fire marshal's code. So we've talked about it. I don't think it's right for Minnesota. I think we get better buy-in from folks, the direction we're going, but I certainly respect those individual businesses who may start to think that this might be a better way to build confidence.
And you said you're going to ask next week for an extension of the emergency powers. Is there a benchmark for when you will let those lapse? Have you given that some thought about when we would be at a point where you don't need those powers?
Yeah, it's all been around where we were at in the point in the vaccine. At this point in time, it's really around vaccination capacity and necessities of things we need to do to receive federal funds. If we are not in a emergency power situation, it changes some of the things we get from the federal government. Now, I asked them if they wanted to put that in, codify that, to do that so that I don't have to do it so that we get the federal funds to do that. That hasn't happened. And so I think what you could anticipate, what it's going to take, and they could put it into law, we may need to have state-run vaccination sites for the next 6, 8, Jan, maybe into the near future, and then when boosters come or whatever, they may be able to put that in there. So right now, it's just operationally is why we're using those. I think this thing when it became politicized is saying, well, the governor's using emergency powers to close businesses. We're using the authority of the health pandemic to make sure that we weren't spreading it further, and the emergency powers gave us that. At the point we're at right now, after May 28th, most of those are gone. And again, the legislature could take out the last two big ones, which would be the eviction moratorium and price gouging, that they could just codify those into law, and I think they're close. And so at that point, we'll see, Tom. I don't think there's going to be much talk or much complaint around the emergency power unless it's being used, just as a strictly political thing. I think they'll want to do that. I do things every day that are constituted to the executive branch that the legislature doesn't do because we have to carry them out. They pass legislation, say, around, highway construction, and then it's my job to implement how we're doing that. And some of those things make moving things around to get federal funds or whatever. So,
are you concerned about the political implications the closer you get to the 2022 elections of having these powers for such a long time? Or, as you joked earlier in your speech, you want to keep people alive long enough to vote against you if that's what it takes?
I do. I think most people understand. Again, the thing when people see these emergency powers go away, many of them are actually things that if you were conservative, you wanted to have. It reduced some requirements, some regulations. And the one that I get a kick out of, that we have to end this, that gave bars the authority to use state right-of-way to set up tables so that they could serve people outside and increase their capacity. So why would they have wanted to take that away from, if Slippery's wants to drag a table out in Wabasha and it works with the city, they should be able to do that. So I think it'll become less. But what I get is it's a lot about narrative. And again, since January, many of these things could have been legislated. There was nothing that said you couldn't legislate them, and I said I'd sign them into law. For the last 2 months, I've been having daily conversations. Can't you just codify the eviction moratorium? Can't we get an off-ramp here? We all agree that it'd be economic catastrophe to have mass evictions. We also agree that landlords should get paid. That's why we implemented the Rent Help Minnesota program to get that done. I just think now it becomes an easy talking point, especially after the 28th of May. I mean, keep in mind, and again, if we get vaccinated, and certainly July 1, if we use that, the state is only vaccinating people and using the emergency powers to have the federal government reimburse us for things we're doing.
Thank you.
Governor, I'm curious.
We'll do two.
I'm curious what high school graduation ceremonies will look like, and if the state is giving any guidance on how those should look.
Yeah, maybe I'll let the health commissioner. There'll be guidance and their recommendations. I think, you can all do the math on the dates. They can gather outside unlimited, and after the 28th inside, in any way they see fit. The only thing they'll be asked to do is if they're inside, they'll have a mask on. If they're outside and they're under 500 people, they won't. And so I think each will decide. Now, I would hope, and the commissioner will do this, both commissioners will do this. We have some areas that are still hotter than others. We have some areas that have higher incidents. Again, we're basically talking 1 month from today when a lot of those things will start to take place. I just want to encourage Minnesotans to get to 70%. We need about 474. There were days that we were vaccinating 56,000 people a day in Minnesota. And the federal government has said, if you have that kind of demand, ask us for the doses. So if I would like to see our website get almost crashed by people saying, all right, I'm done. Now's the time I'm going. But other than that, they're free to do what they need to do. Is that correct, commissioners? That's what you're like. And Jan, you'll be putting out recommendations. My guess is that if you do that, you'll see a large number of people, especially if they're concerned or for whatever reason, they will be wearing masks and distancing. I'll go, Peter. We got time to get a couple of
Governor, the Senate has passed an eviction off-ramp bill with 48 votes, including 12 DFL votes. So it might sound to people that they have not done that thing that you're asking them to do.
They got to finish it. That's not finished. They have to conference it, and it has to be done, tightened up, and on my desk. If the legislature comes to a compromise that is workable for them, I'm certainly not going to hold them up. We had a few principles in there. I think probably the biggest sticking point to me looks like the time in that. I do think that maybe we helped with that with the the 15-month of rental assistance that came with the last Recovery Act, and now that's implemented. So I think they can button that up and get that over. And again, that would go back to where Tom's at. That would probably take off the last of the mitigation pieces as they see on the emergency powers that really, other than just the maintenance stuff. Dave?
Slightly off COVID topic, but it's more important. The walleye opener will be on May 15th this year. That is the weekend at the end of legislative session. Will you be out there fishing? Will you invite Senator Gazelka onto your boat? And will you guys talk walleye and end of session solutions?
Yeah, this is a time-honored tradition, and last year we did do that, and it falls on that weekend. It's a time that you get out there. I do believe, and I do believe Senator Gazelka let me know that he has a family conflict and won't be able to, but we talked about it, and I did ask him to be there. There may be some others that will be there. We can certainly do that. We'll be outside. You know, folks will be vaccinated. We're going to be up in Otter Tail County for the walleye opener, encouraging people. I think Commissioner Grove could talk better about this. The economy has definitely changed. Things made a big difference. Last year, we saw our largest purchase of hunting and fishing licenses than we have in a generation. We've got a whole new group of people who are into this. This is what Minnesota has. So I'll try and encourage them. We'll be up there. It is a golden opportunity to do that. So maybe there'll be a few others up there to.
And Governor, we are the state of hockey as well as the state of fishing. The NHL season ends May 19th. I assume the Wild will have a playoff game sometime before the 28th. Will they still be restricted to what do they have now, 3,000 fans? Or how is that going to be?
Isn't it?
Is there a playoff exception?
It's gone up as of tomorrow, so.
Yeah, there's no more cap on the total number of people you can have indoors. It's just based on capacity percentage. There's an online calculator you can find at staysafemn.gov to plug in the number of seats that you have and figure out your capacity. But essentially, we've popped those percentages up for indoors, for seated and non-seated, in the interim between now and the 28th. After the 28th, no restrictions at all.
Okay.
If they make it further in, Tom, they get to the 28th, it's a full house.
Yeah.
Okay. Yep. Got it. Thank you.
Governor, did you say you were inviting legislators over for a barbecue? Can you tell us a bit more about that?
I threw that out here now. I'm sure my team's saying, wow, that's great. You maybe should have let the First Lady know that before. Yeah, I think we get back to that. I have to tell you that I do think some of that has been exasperated. No, not some of it. A lot of it has. All of you have lived this, and some of you live your lives, with the camera, but that has just made it hard. It makes it less personal. The attacks become more personal because we're less in person, which really ratchets it down. When you're sitting in a room with someone looking at them, it's much better. So we started last Friday. Really, the first meeting was a week ago tomorrow, where I sat down with the leaders, Democrat and Republican, in the conference room at the Capitol to start talking about that. And again, I don't think it's by chance. That was the most productive and cordial meeting that we've had. And so I do want to invite them over. I think that's one of the things. We used to do breakfast together. We've got to get back to that where we just differ. But it's not this, you're the enemy and everything you say is wrong. We've got to get away from that. So I will invite them. We'll get this done. I think over the next, week and a half that we're doing this, it would be good for us to talk, but to socialize a little bit, get the humanity back. And we got golden opportunity to redo things differently after this. We've got important work to get done. We're not going to get everything that everyone wants, but we really are in a pretty unique spot that this divided legislature once again, and the fiscal shape of the state is solid enough that we should be able to do some things together that don't cause the massive rift or the breakdown that sometimes happens when you get to the end. So yeah, I want to do that with them.
Will any of those interactions be limited if certain members are not vaccinated?
Yeah, that's a great question. No, I don't think so, but I think it would be a time for some good-natured, just come on, get this done. I greatly thank former Governor Paulini, was very clear and understood this. So I think it's very clear he and I differ greatly, but I respect him. He's a friend, and I ask him to come show people that this is not political. I keep saying that. And I don't, again, it's people's personal choice on this, but I have heard some Republican legislators say they've gotten vaccinated. They're glad to do that. So I wouldn't limit it on that, but I would I would ask that folks do that. I mean, we can be just good examples on this, good role models that, again, Minnesotans overall are for vaccination. So if you do it for just political reasons, the majority of voters think you should get vaccinated. So it's a good point. Maybe we could give a vaccination clinic in the backyard. I don't know. All right. Well, I just want to say again, we'll be together a little more, but this has been a journey for all the folks in this room. It's been a challenge of managing their own families, their own health, while telling the story in a very chaotic, very unknown global pandemic that had serious political over and undertones in the middle of a national election and deep racial unrest in Minnesota. So I think Minnesotans, again, to pause for a moment and realize the information you're getting, the questions that you want to ask are being asked by the professionals who do that and listen to you has been really, really important. We're not done yet, but I think the way we've navigated this together, the things that worked, the things that didn't work, the questions, I am deeply grateful for that. And these sessions of getting to ask and asking and us having a clear understanding this is our responsibility has been really helpful for the state of Minnesota. So you have my deep appreciation, and we're here. And I'm sure you are all not typing your stories, but buying Twins and Wild tickets. So go at it. So thanks, everybody.
That was Governor Tim Walz wrapping up a press conference on the day he announced the lifting of nearly all state COVID-19 restrictions by the start of the Memorial Day weekend, starting tomorrow in a phased effort, removing capacity limits for outdoor dining, community events, and get-togethers, and ends the mask requirement outdoors except at large venues with over 500 people. May 28th, second step when remaining capacity and distancing limits will come to an end. And then the key is that third step, once 70% of Minnesotans 16 and older get at least one dose of vaccine, they will lift the mask requirement, but no later than July 1st. Stay tuned, much more on the story on the air and online here at mprnews.org. In the meantime, more on the story, the COVID story from The Takeaway.
It's The Takeaway. I'm Lizzie O'Leary in for Tanzina Vega.